My husband says he feels like there is cotton in his throat. It doesn't hurt him or anything. He isn't coughing and there is no blood or anything like that. It is just always there. Our doctor put him on Protonix, thinking it may be due to reflux, for about a week and it really didn't do anything. He wants him to have an upper GI done now. Should he also have an MRI? Is this something to be very worried about? I keep thinking of cancer. I am worried more than he is.
Dry mouth usually feels like cotton mouth, and is caused by a decrease in saliva production. Cancer treatments can cause it, but cancer itself is not usually the predominant cause. If he's taking any medications, it would be ideal to reconsider whether or not one of them is causing this as a side effect. Blood pressure meds, anxiety and depression meds, antidiarrheal meds, opiates, can all cause this, but there are hundreds. http://www.wrongdiagnosis.com/symptoms/dry_mouth/side-effects.htm. Protonix is on the list as well, by the way, pantoprazole, so it may exacerbate the problem. Use of caffeine, alcohol, or tobacco can cause dry mouth as well. As people get older, the salivary glands do tend to produce less saliva, so dry mouth may simply be a result of aging. People that tend to open mouth breath often suffer from dry mouth. It can, however, indicate an underlying medical condition in some cases. Simple dehydration and not getting enough fluids is one cause. Others include diabetes, anemia, hypertension, poor oral hygiene, stroke, rheumatoid arthritis, cystic fibrosis, Parkinson's, viral infections such as HIV, fungal or bacterial infections of the mouth or throat, including thrush, and a type of autoimmune condition called Sjögren's syndrome. Nerve damage in the mouth, head, or neck can alter the sense of thirst and dryness as well. These should all be ruled out. If no identifiable cause is found, there's an oral rinse that can be prescribed to moisturize the mouth and throat, as well as a medication that can stimulate the glands, Saligen. In the meantime, he may try chewing some gum, sugar-free, to stimulate salivation, and increasing water intake to reverse and prevent dehydration, breathing through nose, using a vaporizer in the house, particularly bedroom at night when many people open the mouth to breathe and dry the throat. OTC saliva substitutes are also available for short-term relief of symptoms. An upper GI barium study can rule out reflux, and endoscopy can rule out infection, inflammation, and any other abnormalities of the throat and mouth, but blood tests to evaluate blood sugars and iron levels, and serial evaluation of blood pressure to make sure hypertension isn't a problem needs to be performed as well. I hope this helps. Hi there. Your husband most likely has a condition that is called as globus pharyngeus, in which one feels that something is there in the throat all the time when as a matter of fact there is nothing there. The most common cause of this condition is gastroesophageal reflux disease, which is the reason why your doctor prescribed your husband anti-acid treatment. To be effective in treating globus pharyngeus, treatment for a possible acid reflux should be continued for at least 3 to 4 weeks. I do not think that 1 week is sufficient enough time because of the very fact that it takes a few days for the drug's peak action to set in. In some patients, this condition may require 3 to 6 months for adequate resolution. Another common cause of this condition is stress and increased anxiety. Quite often there is no cause found for this disorder. All testing such upper GI endoscopy is negative in cases of globus pharyngeus, which I presume it will be. I do not think that he needs an MRI for this condition. Please let me know if you need more input. Kindest regards.
If you have a health question and want to chat with a doctor now, visit justanswer.com/ythealth.